Hello, everyone. This is Catherine Gould. I'm a licensed clinical social worker and adjunct faculty at the Carver School of Social Work at Campbellsville University. Today, we're going to talk a little bit more about what best practice is as it relates to the field of social work. The definition of best practice is really born from the business arena. Best practice is something that you hear about a lot in that type of work, but it is definitely applied to our practice in social work. Like evidence based practice, best practice is something that is driven by repeated and well tried and true best behaviors in the field. Things that work, that are effective, and meet the desired outcomes that you're trying to achieve with the population you're working with. It tends to be recreated and frequently utilized, and it can be based on evidence or just strictly experience. Again, it doesn't have to be based on research. It could be something that is done over and over again and found to achieve the most desired outcomes. It is considered the correct way of doing something, and of course, it evolves over time and are not necessarily formally evaluated, but shown to be successful due to repeated positive outcomes. What is best practice made of? A best practice in social work generally consists of a technique, method, or process of achieving the desired outcome. Many different fields employ best practice principles that are reinforced through policies and procedures to guide how employees do their work. And of course, this is related to social work as well. Ideally, it should be based on effectiveness and data-driven outcomes. Again, even though it doesn't have to be formally research-based, you should see that you're achieving the effect that you want to achieve when you utilize the best practice principle. Desired outcomes are what happens when best practice is followed. That best practice should improve the well being and capacity of a program, a population, or an agency. Negative outcomes should be minimal or not at all, because after all, how is it best practice if you're getting something or achieving something that is not working with your client base? If the best practice is adopted and starts to show undesired outcomes, it can be changed, adopted, or scrapped altogether. And again, in social work, we're all lifelong learners. Our practice evolves and changes over the years as we gather additional information, as we learn new tools and ways of doing things. That's why we continue to be educated through CEUs, through supervision and consultation. And again, that should definitely impact how we do things and what are best practices that we utilize and how we adopt those. Best practice as it relates to social work, when we think about social work best practices, we realize that they could be varied by agency, by the population that you're working with, by the level of social work, treatment outcomes, grants, and etc. So, what works and becomes best practice at a micro level may not be the same best practice principles at a macro level. What works with an aging population may not be the same thing that works with a young adult population. And so, although they are often grounded in our code of ethics and drives the practices that we choose, it can definitely be varied across different agencies, different populations, and what we're trying to achieve with the populations that we're working with. And again, what works with one population may not be best practice with another. When you engage with a child, you're definitely going to engage in different best practice principles than maybe what you would do with an adult population. A substance abuse dependent or utilizing population versus a population that is, for example, just mental health based, so maybe not a dual diagnosis situation there. How you would engage in substance abuse treatment with children would be very different than how you engage in substance abuse treatment potentially with adults. And so best practice principles may be similar, but also varied to meet the need of the population that you're working with. Your code of ethics often drives best practices, and remember that you may be working in an agency that employs a varying scope of expertise and a varying scope of practices. So you may be working on a multidisciplinary team that engages with nurses, with different mental health professions, with doctors, and we all have different licensures and different code of ethics to uphold. While they may be similar, they are different and variant, and so you definitely want to make sure that the best practices that you utilize are upholding your own code of ethics, our social work code, and are driven that way. Some examples of best practice is following the code of ethics and your agency policies, not going out on your own, but making sure that those things definitely always guide you and ground you in your work. Gaining informed consent to either treat or practice with a population, and remember if they're under the age of 18, that would be assent instead of consent. Grounding exercises or coping skills could be an example of best practice. Utilizing them with your clients can be something that you do every single time and is definitely a great treatment skill to utilize. Not practicing beyond your scope of care and doing no harm. Seeking supervision and consultation is something that we should do as social workers throughout our whole process of being professionals. Using trauma-informed practice can be an example of best practice. Sober living environments for those who are engaging in substance abuse treatment. Utilizing strengths-based and understandable language with the population that you're working with. Again, if you think about a child versus an adult, you want to make sure that you utilize and taper your language to their ability to understand it and comprehend. Being culturally aware and informed. Utilizing a least restrictive environment when it comes to, for example, hospitalization or residential treatment. Treating clients with dignity and respect is always a best practice. Session or group planning could be a best practice. Using measurable treatment goals is a best practice. And reviewing notes, files of clients that you're working with prior to working with them or entering into a therapy session are all examples of best practice principles that, again, may not necessarily be founded in research, but are founded in repeated exposure to and knowing that these are things that work effectively with the different populations that you're working with and guide how we practice in the field of social work. Again, best practices can be varied. There's so many of them out there and they evolve and change over time. So I hope that this is something that has helped you increase your knowledge and understanding of best practices. I definitely recommend talking about best practices in your supervisory sessions and going over them as you continue to be a lifelong learner in social work.